The National Institute for Communicable Diseases has confirmed close to 100 cases of measles in Limpopo and Mpumalanga. Limpopo has the highest caseload at this point. Let's get an update on the situation and speak to the MEC, Dr. Phophi Ramathuba, who joins us now shortly to talk about the situation in the province. MEC, you and I think first spoke about the measles outbreak in Limpopo about 2-3 months ago. How is it that it's got so worse?
Good afternoon to all your viewers. If you remember when we first discussed this issue, we have indicated that measles is one of those highly contagious infectious diseases. As such, it's easily to spread as compared to any other infectious disease that we usually deal with. So it makes sense that when you have one case, you might end up by the end of the day having 5 or 6 people being infected because of that particular one. So as it is for now, as a province, we saw the number of cases increasing, and some of them having a travel history, especially if you remember the cases started, the outbreak was at Sekhukhune, and the case in Mopani, we could trace them that they had a travel history of having traveled to the Sekhukhune district. Hence, we are currently saying, now that we are approaching the festive seasons and the schools are closing this week, we're expecting an influx of children from other parts of the country coming back home to the province where they are staying with their parents, where their parents are working. And also we'll be seeing some of them even crossing the border to Sadek region where we have also seen an outbreak. So we are encouraging parents to make sure that all the children, their children must have been vaccinated, and those that are fully vaccinated, there's nothing wrong by getting the child to get a booster, especially children between the age of 6 months and 59 months. We're saying so that when they enter the measles endemic area, then they get contact of those who are infected. They don't get infected, and when they go back, and then we then spread it, as I've indicated, that because it's highly contagious, if we don't manage it, we might find that the whole country end up having the crisis of dealing with measles.
Let's talk about the greater Sekhukhune district, because from what I'm hearing, it's basically the epicenter of Limpopo's outbreak of measles. What is going on in that district specifically that has made it more vulnerable, shall we say, to measles infections?
I think what we can indicate is that in the past 3 years, because of the COVID-19 pandemic, we dropped the ball. There's been a lot of, as we always say, healthcare services were affected across the board. Patients who were taking ARV, some of them even defaulted because of the COVID-19. Now, it is the norm for us as a Department of Health to say every 2 years, we go on a campaign for measles vaccines, reminding the population that South Africa as a country has declared that by 2030, we should have eradicated measles. So we've been doing that every second year, and we've been winning. That's why we have not been recording any single case of measles. But the past 3 years, 2020, 21, 22, we could not do that campaign until this year when we started with our surveillance. And then around Vegasfort, towards the Fikakhomo municipality, which is an area which has got a lot of mines, and they've got a lot of migrant workers there. There's a lot of integration there. There's a lot of population density within that particular area. That's where we saw during our surveillance the first cases being declared there. And unfortunately, those cases, some of them, when we traced them, we realized that they were coming for consultation in one house of a traditional leader where there were more than 20 people in that household. So that's where it started. Hence, we had to move into the entire village and try to trace some of those patients who were there to be treated, who some were not necessarily coming from Sekhukhune. Hence, you see the spread in other districts. So we can attest to that. But I must indicate that we've been able to contain in Sekhukhune, because since we registered around 29 cases last week, we have not registered any new case. We've made inroads in terms of vaccinating, whether it's early childhood care centers or it's the primary schools. We've done fairly well in trying to do that. We worried about now Mupani having taken over to be the epicenter. Mupani has registered now 32 cases. And also Waterberg, which just started now to register the first case, they've already jumped to 17. So those are the two districts that we are more worried about. Otherwise, Capricorn, Bembe, it's still at 3 cases. But those two districts, Mupani and Waterberg, are our main concern.
How concerned are you about under-detection of the measles prevalence in some of these areas? I mean, you mentioned, for example, Sekhukhune, where you recorded your first infections, and you're saying you've been able to contain that situation. But I wonder if a lack of new confirmed cases necessarily means that there are none.
You see, the issue is that the moment we detected the first case in Sekhukhune, we strengthened our surveillance. That's why we came up with a lot of numbers. You see, where you were going to have a problem of failure to detect, it's where you would see a high mortality rate. Now, in this case of Limpopo, we have not lost even a single child or a single patient as a result of measles, meaning we are able to detect them early when they develop the rash, because we did a lot of campaign, working together with the local media, the local radio stations. We work with the local, whether it's print or electronic media, to try to talk to the people. We worked with the churches around the province. We've worked with the local leadership, whether it's traditional healers. We even took them through the training to understand symptoms of measles. So that is why we're able to pick up even more cases. So I'm not so much worried, because we've been monitoring any death of a child in any of our facility or even dying at home, if that death could be related to measles. We have not registered any of such. So which means our surveillance team are really on course in terms of picking up such cases. School teachers were able to assist us. If a child is sick, according to the parents, has got flu-like, it can't come to school, we usually send our healthcare workers to go and assess the child, even take blood for IgM to rule out measles. So that has been able to assist us.
Right.
You know, if you look at the tests that we have done, the number of cases that we identify, you know, a contact tracing, we've done for more than 4,700 of those. So our contact tracing has been strengthened, and our response team, working with the NICD, I must really appreciate their support, and also working with the WHO officials in the country, it has been able to help us to reach out to as many people as possible. And currently, lastly, we are busy on a vaccination drive. We can't wait for January. We're saying you will see us on the road. All our clinics have activated their vaccine campaign to say any child who is between 6 months and 59 has to be vaccinated, get a booster even if you are fully vaccinated, because from all the cases that we've studied, the reasons is that children who have not been vaccinated might have been responsible for the outbreak and the spread of measles.
So as things stand, MEC, can you confirm to us if each and every single clinic in Limpopo, even in the most remote parts of the province, has a vaccine for measles, sufficient stock to be able to give one to whoever wants one?
For now, we can indicate, we can reassure you. Yesterday, we had the National Health Council meeting, and we did ask from the National Department of Health, because the supplier, this is a national transversal tender, so that they can be able to reassure. And I can tell you, the directorate responsible has reassured that indeed we do have a stock currently, but in the province, I can say we do have stock. I've been moving around the deep rural parts of Sekhukhune villages to check if even our mobile clinics do have those stock. We do have stock. Currently, we are not struggling with the issue of stock. We're not sure, because now, since the beginning of this week, when we started with the campaign, we are starting to see a lot of parents showing interest. And I've also indicated, especially children who came back from schools from other provinces now, we have seen them, many of them coming to our clinics, their parents calling to say, we need to get our child vaccinated. So we're not sure if the demand will exceed what we have, but for now, I can reassure the people of Limpopo and the country that we are covered when it comes to vaccines for measles.
Limpopo Health MEC Phophi Ramathuba, thank you for your time today.